Good afternoon, everyone. Firstly, I would like to thank the ANH Academy for giving me this opportunity to be here this afternoon. I really appreciate, and I hope we'll be able to work together in the future. This study is supported by my university as part of our community development efforts. It is part of a wider study designed to look at other things, among which is zoonotic diseases. It is designed to cover over 50 villages in northern Nigeria, especially around the location where the university is based. And for now, I have just about results from 10 villages that we've covered so far. So I will be speaking to you about farmers' knowledge, perception, and farmers' knowledge, attitude, and perception of zoonotic diseases. So what are zoonoses? These are diseases that are spread from animals to humans. In essence, it's all about animals and people. So the animals concerned can be pets, they can be livestock animals, they can also be wild animals. Our concern is that zoonosis can transfer or can get from one human being to the other. In essence, there can be human-to-human transmission. And if this occurs, there can be a global spread, which is really disastrous. The Ebola virus disease outbreak in 2014 in Nigeria, Sierra Leone, Liberia, and the DR Congo, and also the current outbreak in the DR Congo this year is of great concern. So many lives were lost, and we do not want a repeat of such a scenario. So what happens if there is an outbreak of zoonotic disease in a farming community? Firstly, the farmer's health and that of the household members who provide the bulk of the labor is affected. Again, the time normally devoted to farm activities are now diverted to caregiving. The little resources that should have been spent on buying inputs is now used to buy medication or to pay for medication. Again, the number of individuals that will be available to work on the farm reduces because agriculture in Nigeria is more of family labor dependent. So if many of the household members are down, the agriculture will suffer in terms of productivity, and ultimately, the household food and nutrition security will be affected. Low productivity implies less to eat, and the resources that could be used to buy food are used to buy drugs to take care of patients. Now, what is the current situation? Northern Nigeria is renowned for livestock production. Different species can be found. Small ruminants, large ruminants, and also poultry are found there. And they are used as a source of food and, of course, cash and both in some cases. Now, these animals are kept in very worrisome conditions, very close to residential areas. There is indiscriminate contact with these animals. There is a perfect breeding ground for zoonotic diseases created. That is our worry. So we felt that it is important for us to establish the level of awareness and the level of knowledge of routes of transmission, symptoms, and prevention of human infections. And then it's also very important for us to identify the key drivers of zoonotic disease infection in the study locations. Our methodology is simple. We use cross-sectional data collected from 10 villages selected across northern Nigeria. We started last year, so it's still ongoing. So what we have now is for this 10 villages. So household survey with about 200 respondents, and we have focus group discussions with 6 to 10 persons per village, making it that's about 200 households, and still counting. So our results, these are just some simple descriptives. Sheep and poultry are more popular with the respondents, but the average number is higher for poultry and goats. We have about 10 birds per household. Well, in the case of goats, you have some cases 5. But for cattle, the average is lower, 2 in most cases. And the management system is more of semi-intensive. The animals go out in the day to graze and they come back at night. So nobody really cares where they go, how they mingle, what they come in contact with. Again, we looked at the major livestock products consumed, and roasted meat seems to be more popular because it is readily available on the streets and they are very affordable. So they are consumed in addition to raw milk and roasted chicken. Raw milk is used in addition to millet flour as a local delicacy in the northern Nigeria. We call it fura in the local language. So it's a very important meal. Incidence of livestock diseases that was reported by over 70% of the respondents. But visits to veterinary clinic are very discouraging, very discouraging. You can see their monthly is just about 10% of the respondents, so very discouraging in terms of visit to veterinary clinic. Then we looked at awareness on zoonotic diseases. This is also surprising, just 30% are aware. And the major source is from the mass media. This is not surprising because after the 2014 outbreak, a lot of public enlightenment was created on Ebola and other zoonotic diseases in the mass media. So it's not surprising that the mass media is leading in doing this. In fact, a lot of radio jingles, TV programs, and even movies were produced in order to sensitize people about Ebola in particular. So we went further to ask those who are aware the name of the particular zoonotic disease that they know about. Again, Ebola seems to stand out. Surprisingly, brucellosis is not mentioned. And I said earlier that consumption of milk is popular in the location, but they do not know about brucellosis or mention anything that appears to look like brucellosis. This is actually worrisome. So we went further to ask what they know. That is, for those who are aware, we now segregated and they wanted to know what actually, or how much do you know about these zoonotic diseases? So those who know knowledge on prevention stand out. And of course, this is attributed again to the mass media education. So we asked about route of transmission. Most respondents know about contact with livestock animals, not better than the other routes of transmission. So from our focused discussion, we're able to synthesize the transcript and we're able to identify the key drivers of zoonotic disease infection in the study area. Firstly, the semi-intensive method of management plays a huge role in this. Then the proximity of the residential areas to the animal housing is also a key factor that is helping to drive the outbreak. And then the low awareness on the zoonotic diseases generally, apart from Ebola. The other ones like brucellosis, anthrax are not well known. And then there is low awareness too on prevention. I remember during the 2014 outbreak, a very funny but sad event happened. Individuals were sending messages that the Ebola virus is in the air, it is coming and it's going to consume the entire country. So people were asked to take a lot of salt water and to bath with a lot of salt water. Some did this and they developed health complications. So it's unfortunate. And the message went viral, and I remember I got one in the middle of the night from some family members that this is what is happening. So those who took in the salt water due to low awareness really developed complications. And the consumption of products, especially this raw milk, is also a key driver of zoonotic disease infection. Unfortunately, when individuals fall sick, it is assumed that it could be malaria or typhoid. Nobody really bothers to investigate further. Could it be something else? So as an economist, I try to maximize everything, including time. I'm being told that my time is up. Thank you for listening, and have a wonderful day.